Welcome to the Elaborate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Welcome to Elaborate Topics. We are your hosts, Tywauna Wilson, Stephanie Whitehead, and Lona Small. We are so excited about this opportunity to talk with you about all things medical laboratory. Before we get in too deep, let us introduce ourselves, tell you a little bit about who we are, why we chose the field of medical laboratory science, and a little bit about our journey. So my name is Tywauna Wilson. I am from Cincinnati, Ohio. I have been a medical laboratory scientist for over 15 years. I got my start at Kentucky State University, which is where I went to undergrad, and I did my clinical training at the University of Cincinnati because my college didn't have a formal clinical program. And so I started this journey back in 2004 as a generalist. So I worked as a generalist in the clinical laboratory, a high-volume reference laboratory on third shift like we all tend to do. And then I just moved up from there. So I worked as a generalist. And then I moved to first shift. I've worked in all areas of the laboratory: hematology, chemistry, toxicology, blood bank. I've worked for reference labs. I worked for hospital labs, pediatric facilities, you name it. I've probably done it at some point in my career. I've been a bit of a risk taker. I do have a master's degree. I have an MBA. I chose to go that route because I felt like it would diversify my skills and give me an opportunity to move up into leadership as well as outside of the laboratory if that's what I so chose. And so currently I am a leadership trainer, coach, and consultant. I also am a system technical director of a large regional laboratory in the Dayton, Ohio area, where I oversee all things standardization in regards to clinical chemistry, toxicology, front-end automation, new equipment across all of our hospital locations. I have 7 hospital locations that would report up through me in regards to the chemistry and technical expertise. And so when I am not doing all things lab, I love training the next generation of leaders. I know that sometimes we are or feel like that we are unheard, unprepared to assume these leadership roles. I know for me, my first leadership role, I felt like I was thrown into the fire, and that's why I am adamant about making sure that the next generation is prepared. And so I'm just so excited about this podcast and why it's needed. You know, I've talked with laboratorians from all over, and they feel as if, you know, they're unheard, and we are those unsung heroes behind, if you think about the healthcare landscape and you think about everything that's going on in our world today. From a healthcare standpoint, the laboratorians or lab is just now getting front and center in our current pandemic because we're the ones that's running the tests, right? But before then, you might not have even heard of the laboratory. And so this podcast is important to bring exposure to what we do, for us to serve as advocates for ourselves, for us to be educated and informed and learn from our colleagues. We have professional societies and organizations that are doing some amazing work, and sometimes you don't know what you don't know. Sometimes you just don't know what's happening in the field. And so we wanted to create a podcast for people to be informed about what we do, for us to inform ourselves, and I'm just excited for you to hear some of the guests that we will have on the show, some of the teachings and the lessons that the other co-hosts and guests will be doing in regards to leadership and quality and all things that we will be talking about. But I'm just excited about this podcast. And I would like to introduce my other co-host, Miss Stephanie Whitehead.
Thank you, Tywauna. Hi, listeners. I'm your co-host, Stephanie Whitehead. A little background about myself for our listeners today. I'm originally from a very small town in southern Mississippi, so I'm not even going to name it because most people don't know where it is, but it's beside Biloxi, y'all. I moved to San Antonio, Texas over 10 years ago for an opportunity to expand my laboratory career. And so today I work as the Executive Director of Pathology Services at one of the largest public health systems in the state of Texas, which is also a nationally recognized teaching hospital. I've been in the laboratory for over 18 years, so I started out around 2002. I went to University of Southern Mississippi. I've been in a director role or a management role for over 14 years. So many people might do the math and be like, oh, she moved up quick, but I started out as a generalist. And believe it or not, when I was a generalist, working the bench, working night shift, working evening shift, I did not like my boss. And I just felt like if she could do it, I could do it. And that was really my mindset in applying for a director job. And lo and behold, I got it. So be careful what you wish for out there, y'all. I was drinking from a fire hose in my first director position, but I muddled through it. So I have some lessons to learn and some lessons to tell you guys, some pearls of wisdom for you. I've worked in everywhere, like Tywauna, from small rural hospitals to clinics, and even did a little bit of time with infection prevention. In my current administrative role, I coordinate a team of 300 employees and a full in-service and outpatient service laboratory. That includes 5 outpatient stat laboratories and inpatient services, which include HLA, blood bank, and donor services. What I found in my personal journey, trying to identify how I wanted to shape my career as a medical laboratory scientist, was there was not a clear pathway. So while I was trying to find my way, I ended up getting several degrees. So I have my master's in business administration, as well as my master's in public health, and a number of certifications and certificates, which include Lean Six Sigma, project management, and patient safety. Outside of the laboratory, I love community service. I love to give back. I love to work with other people outside of the laboratory and collaborate on helping our community as a large. So I work with nonprofit organizations in my spare time, like the Junior League of San Antonio, Delta Sigma Theta Sorority Incorporated, and Girl Scouts of America. Now, for our first-time listeners, you may be looking at, why is this podcast here? Who is this podcast designed for? Who should tune in weekly and listen to us? So anybody working the front lines and all healthcare leaders, particularly those in the laboratory, should be listening every week. As listeners, you'll find the topics myself and my coworkers will cover will be wide-reaching and able to be applied to different disciplines in healthcare. So we want the phlebotomists, we want the medical laboratory scientists, we want the lab technologists, the lab managers, even the executives. We have something for each one of you. Our goal with our topics is to bring you relevant and meaningful information that any listener can use as a resource as they're going about their day. That's what you can expect from our podcast. Elaborate Topics is a weekly, short yet dynamic podcast with clear and concise messages that are important to each one of you, from co-hosts that are results-driven and proven and have proven track records and related topics. We'll be discussing topics like why it's important to stay connected. Like Tywauna said, there are so many professional organizations within the laboratory profession. There are over 17 of them. I didn't even know that. So why is networking important? What is networking, and why is it an important tool of your professional growth? Of course, we'll want to touch on the current COVID-19 crisis and how coronavirus has impacted you and your workflows as frontline heroes performing the testing and helping hospitals battle the virus. How are you doing? How are you caring for yourself? How are your teams doing? If you're a current or future member of management and you're a listener out there, we'll be covering topics on communication. So overall, our podcast will be about knowledge sharing and overall information about the laboratory. So now I'm going to kick it over to Lona Small, who's going to tell us about her journey and how our listeners will have future topics that we will cover.
Thanks, Stephanie. Hi, listeners. I'm Lona Small, and I am a quality assurance specialist at a large institution in Maryland. I was at a place where I felt stuck. I felt as if I wasn't challenged. I wanted more. I wanted to grow. I just was restless. And that was after 10 years in being a medical technologist. I had gone through the whole process. I've worked as a generalist in all the different sections, including microbiology, blood bank, and I became a supervisor in histopathology. And I even worked in a different country because initially I'm from Jamaica, and then I moved to a small Caribbean island, Anguilla, to work. So I saw all different ways in which medical technologists would work. I've actually worked with direct donors in Anguilla because they didn't have a blood bank. So say, for instance, there's an accident and someone needs blood, the relatives would come in to donate blood, and we'll screen for HIV and hepatitis. So I got to see a lot. And so I was at a place where I decided I wanted to go to medical school because initially that's what I wanted. And so I decided to come to the States. And when I came to the States, I decided to do a U.S. degree with the goal of going to medical school. And just after I graduated, the director of the program asked me to stay on to teach. And I was a bit hesitant, and he tried to make it really nice, and he said, look, come on in, start as a tutor because there's so much opportunity, you're really talented, and we'd really want you to teach. So I started teaching. I really loved teaching, but I didn't see that as someplace that I wanted to be for long term. And so I moved away. I had gotten married, and I moved away from D.C., and I was hired to supervise overnight and evening shift in a lab. And I remember a few months after I started in that position, I went to my manager because I had some challenges, and I asked for help. And she looked at me and she said, you better figure it out because I had to learn this by the seat of my pants. And of course, I was very disappointed. Disappointed is kind of a nice word. And I just thought that what I noticed was over the years that a lot of people were being promoted into positions, but it was difficult for them to handle leadership roles. And I didn't think that she was being a very effective leader. And I noticed that over the years, by then I think I was 12 years in, that people were being promoted into positions of leadership based on technical skills. And I said to myself, I'm going to have to be, and it just reminds me what Stephanie said, a much better leader than this person, and I'm going to make sure that I do the work. I'm going to do as much as I can, so when I get into this position, I'm going to be a better leader. And I took that, but I still still had that restlessness. And I'm sure I've spoken to quite a few people who told me, and some people ended up leaving the profession because of that restlessness. I didn't have a mentor. I didn't have anyone to talk to guide me, and I didn't know exactly where I should be going. And so I started looking at med school again. I ended up, as I said, I got married, and that was not a good combination if you don't have a very good support system. And so I started looking at some other things. I looked at biotechnology. But one thing I didn't want to do is an MBA. I kept hearing about this MBA. But then I ended up deciding to do a healthcare MBA, and I'm glad that I did. And what it did, it opened up so much about healthcare and about what we actually do in the lab, which I didn't realize that it was so relevant in terms of being strategic about decisions that we make, being strategic about our leadership. And I learned a lot about leadership, but I still knew that there was so much more to learn. But one thing that happened to me that actually was kind of a game changer, or what kind of changed the way of maybe my mission right now, was I remember being at home with the kids, and a family member came, and it was a doctor, which is a family member, and there was a discussion with my friend who was a nurse, and she was talking about someone with lupus, and I got excited about it because I know we studied that in so much depth, and we did. Over the years, I was doing LE prep, and, I wanted to talk about it, but she turned away from me and turned to my friend who is a nurse and said, "You'd know what I'm talking about." And I was just so hurt, and I said to myself, I can't understand how we all work in healthcare, and we're supposed to know what each other do, and apparently she doesn't know what I do as a medical technologist. And later on, I was going to work, and she said, "Hurry up and go take care of that Bunsen burner." And that was it. I was like, somehow there's something that we have to do about our profession so that even our own colleagues, they need to know what we do. And so when I was in the healthcare MBA program, there were about 70% physicians, and we did a lot of collaboration. And during that collaboration, I got to learn a lot about how to work together with other healthcare workers. And they learned a lot about the lab, and they were really intrigued. And these were physicians who've been in the field for years. And after I got out of that program, I told myself that I'm going to use the skills that I learned to collaborate with other healthcare workers, because I realized that it's so important for them to know what we do, and it does make a difference. So after I left, I realized I wanted to do more in terms of process improvement and quality. I decided to do a graduate certificate in healthcare quality, and I started doing more programs in lean and business process management, and I kept moving on to project management. And I made that decision that I wanted to do more in terms of improving our internal workflow and working along with other healthcare teams to kind of show the value of the lab. And I made that kind of a mission. And the more I worked with that, the more I saw a gap in terms of how we as leaders treat our own staff. And so I decided to move into coaching and consulting, and I started working with a lot of external coaches to help with leadership. And so I started having an interest in how can I mentor other leaders in the lab. And the more projects I do and the more I involve other leaders, the more I help to mentor them in terms of how do we relate with other healthcare workers, because I realized that I learned a lot in terms of relating to other healthcare workers. And so we were able to make so many changes just by stepping out of the lab, working along with other healthcare workers, making hospital-wide changes. And people said to me, "Why are you still in the lab?" Because people go, they get their master's and they get their other degree and they move out. And I found that I had that deep commitment to almost prove that we are just as valuable as every other healthcare worker. When I sit with anybody else, I know we are just as valuable. And so I started mentoring, and I started preparing courses and trying to help the lab in general to be visible. So that became a passion of mine. And that's generally who I am. And so when we Tywauna and Stephanie, we decided that, this was really relevant, because I know, there are some people who may not want to do an MBA. Some people who may want to do an MBA. Some people may just want to know more about how they can do better as a medical technologist. So we have different topics that's relevant to almost everyone. People want to be the best technologist that they want to be, a leader who may want to be the best leader that they should be without being going for MBA, or someone who may want to know what other degree can I go for, what other certification that I could use depending on your interest, if you want to do lean or if you want to get into compliance or maybe billing. We'll have guests for that. We'll have guests to deal with maybe if you're interested in project management. But the most important thing is how can we be the best lab that we can be, and how can we stand out without being hidden. We want to be visible, and hopefully this podcast will help us to be more visible and give us the courage to stand out and do more for what we already know how valuable we are. So I'm really excited about this.
And Lona, I think what you just said about visibility is so pivotal, because although there are many statistics that talk about how over 70% of the results that clinicians and doctors use to treat their patients are based on the precise results that come from the laboratory, and even though we talk about how many national organizations support the laboratory, many of our stories discuss how we kind of stumbled into this profession, and the road towards growth in our careers were sometimes met with disappointment and, stumbling blocks and challenges. And so I think it's my hope with this podcast that it be a platform, like you said, for mentorship and succession planning for our future techs or our current techs out there who are really just trying to find their way in medical technology, and that they start to understand their importance in the entire medical team and our place in that medical team.
Absolutely.
So
I think you all said it the best. And when I was listening to you all's introductions, it just made me think, as laboratorians having our education, we are able to do so many different things in the laboratory, in healthcare, in pharmaceutical, government. And what has been instrumental for me, I know when I first started my career, and I'll never forget it, I was going through my clinicals, and one of the scientists said, never forget, with a degree in medical laboratory science or medical technology or clinical laboratory science, depending on when you came through school, it might have been called something different. But she said, never forget, with the foundation that you're going to get in this profession, you can do anything and go anywhere. You're not limited to working, in the hospital laboratory, on the bench. There's other things you can do. You can go and work for the instrument vendors. You can go and be an application specialist. And that, for me, was critical, because I held on to that. In that, I said, well, I have this education, I can do anything. And I was able to see a hospital CEO who got their start in the microbiology laboratory as a medical laboratory scientist. So for me, that was confirmation that this degree was where it was at. If a hospital CEO started off as a medical laboratory scientist, well, I could do anything, right? And so the diversity that this field offers is so broad. If that's the thing, you have to be mentored, you have to network, you have to know. I was fortunate in my career that I took a sidestep from the laboratory, and I was able to start an integrated state-of-the-art mobile diagnostics program that incorporated screening, mammography, along with point-of-care laboratory testing. And it's something that I wouldn't have even thought about had it not been for that early laboratorian in my career. So I'm just excited about this field, what it has to offer. I'm excited about learning from everybody that's going to be on the show and learning from you all and your wide variety of experiences. And I just think this is just a great thing.
It certainly is. I'm really excited, and I'm glad that we can serve such a broad audience of, people with different interests, and knowing that as medical technologists, we all have different interests and goals, and just having medical technologists providing that opportunity for all these different interests is really exciting.
Yeah, in the preparation for the podcast, I looked online and I said, let me see what other medical laboratory scientists are out there talking about and what are they doing, what are folks interested in. And there are some professional organizations such as ACLS and the FDA that have some very interesting things out there, but not as many as what you would think. And so I think it's time for us as medical laboratory scientists to put ourselves out there and to be our own helpers, to start reaching out to each other. There's so much knowledge and there's so many resources that it's a shame and it would be a crime if we didn't start to connect with each other, reach out to each other, and share that knowledge with each other. Like Lona and Tywauna said, there's a wealth of interest from even, manufacturing blood products and working with the FDA, from point-of-care testing, from epidemiology. And right now, with the current crisis worldwide, it is super forefront that medical technologists are the ones really pulling us along and helping us get through this COVID-19 crisis with all the testing, supporting us with data, understanding who's positive, who's negative, who's positive and asymptomatic, and what are the statistics that are going to be very valuable to us as we try to fight this pandemic. And so I think this podcast will be very meaningful, important, and very strategic in helping everybody understand their importance and the vastness and the hugeness of the role that you play in healthcare.
This is exciting, ladies. I'm just so happy to be on the journey with you all and seeing what will transpire as we go along this journey week to week. And I would say if I could leave the listening audience with one, I like to say tidbit, leadership nugget, or just laboratory nugget, I would leave them with until next week, because you got to tune in every week to see what we are talking about and see what kind of nuggets you can get. But for today, I would like to leave you with just connecting, not being afraid to connect. So as you are going throughout your day or your week, don't be afraid. Sometimes as laboratorians, we get in our bubble, right? We get in our area of the lab. We get in our corner, get on our bench, and we connect with some of our colleagues who are in different parts of the laboratory, different parts of the hospital, to learn about what other people are doing, or to make ourselves vulnerable, to get out there and meet people. And, using tools such as LinkedIn and social media, if it wasn't for social media and Lona and Stephanie being advocates for the field and being active and involved, I wouldn't have even had the opportunity to connect with them. So I'm just so thankful for LinkedIn and other sources to be able to find laboratorians who are doing some amazing things. When I look at laboratorians in my area and coming into the field, there were not a lot of laboratorians that look like me. And so to be able to connect with ladies, strong, powerful ladies who look like me, who are from different places than me, who got different skill sets than me, is a pretty amazing thing. And I'm just fortunate and very excited to pick their brains and learn as much as I can learn from them. And I hope that you do the same as you listen week to week and share this podcast with all of your colleagues.
All right. Well, thank you for tuning in and checking out our inaugural episode of Elaborate Topics with our hosts, Tywauna Wilson, Stephanie Whitehead, and Lona Small. We are excited to have you on this journey with us, so please subscribe to our show. Leave your feedback. We want to hear from you. Share us on your social medias and email us at elaboratetopics@directimpactbroadcasting.com. Join us next week in the lab, and until then, have an amazing day.
Thank you for tuning in to another episode of Elaborate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel in your laboratory career.